Very good. So we've been talking about the privacy rule, and we've talked about the concept of minimum necessary. We've talked about the penalties that are involved in the with breaking the rules under HIPAA. And now we're going to talk about de-identifying information. And we've talked about protected health information, and that any information that has patient information in it that is associated with any sort of health information is what we're really trying to protect here. PHI, protected health information. But de-identified information can be used by anyone for any purpose. So if you take out the information about that person, it's not a problem. So de-identified information is taking out your name, your address, your phone number, your picture, your fingerprints, and there are several ways that you can do that. The best way to do that is to use the safe harbor method. And the safe harbor method was developed by the Department of Health and Human Services, and it has a set of specific items that need to be eliminated. And as I said before, as we work in our manual here, the back of our book has a lot of information. This is really resource material for you. So in Appendix F, you will see in the back of the book, A, B, C, D, E, F, that there is a list of 18 items that can be removed to eliminate those pieces out of the information, and that is considered under the Department of Health and Human Services de-identified information. So again, in the back of your book, in addition to having the security rule and the privacy rule, you actually have these appendix that will give you some more information. Now, there is another way to look at that. There are, under certain circumstances, small groups, people over the age of, in the elder years, people with AIDS, small geographic groups of people. And in those cases, the safe harbor method isn't going to be appropriate. So you also need to have a person with the appropriate knowledge available to you when you are working with small groups of people, small geographic groups, people over the certain ages, people with HIV. So those two areas are two ways that you can de-identify information. There is also what is called a limited data set. There are two different ways that researchers look at our information. And with a safe harbor method, if researchers are doing research and the information has been de-identified, under the safe harbor method, they are allowed to have a re-identification code. And that re-identification code can be used in the case if the researchers come up with a cure for whatever it is that they're researching, so that they can then go back and re-identify the population that they are doing the research on and contact them and let them know about the cure. The limited data set is restricted to have a re-identification code, because when researchers are working with a limited data set, they have taken out most of the common items in that limited data set, but there may be potentially identifiable things in there. Things like birth date, admission date, dates that the healthcare procedures or services were done. It may include geocodes or mapping features, but there might be just enough PHI in that information to fit that specific purpose. So the limited data set is very different because it does have some revealing information in it, but it is totally restricted that you have a re-identification code with a limited data set. Again, in the back of your book, your resource manual in Appendix E, you will see this list for a limited data set. So again, this book is your reference material as you go through the program and the curriculum. Let's talk about use and disclosure. Earlier we talked about terms that are HIPAA terms, that are common in other areas, but HIPAA comes along and they have kind of redone the dictionary a little bit. We all went to grade school. We know that using and disclosing and sharing are all the same thing, right? Not with HIPAA. With HIPAA, use is very specifically sharing, applying, utilizing, examining protected health information, anything that is moved inside your organization. And disclosure is specifically the release, the divulging in some manner, information that is being disclosed or transmitted outside of your organization. And there's a lot of confusion there, because if you don't know that use in HIPAA is inside and disclosure with HIPAA is outside of your organization, it can get really confusing out there. For example, if we take a look at this little chart, we see that if Sally's sick, checks into the hospital, and she has appendicitis symptoms, and her general practitioner has spoken to her, and he meets her at the hospital. He says, oh, I think there's something going on here, so he will give the protected health information to the surgeons, and the surgeons will say, yes, this doesn't look good, and let's have an x-ray. X-ray people are now looking at their protected health information, and they are seeing that, yes, Sally needs to have some surgery. So the scheduling team gets the information. The operating room gets the information. She goes back to her room. Now the nurse has her information, all of her protected health information. Billing gets that information. The switchboard gets that information in case their loved ones call in. That's all use. They're using the protected health information. She checks out of the hospital and goes home, and they call in her prescription at a pharmacy. They have disclosed the information. They send your information to the health plan to receive payment. They have disclosed the information. Maybe she was in a car accident, and the records are now being disclosed to the court through a subpoena. So that's the difference between use and disclosure, and herein lies the problem with HIPAA. HIPAA's kind of made up some of their own words, and not everybody's familiar with the vocabulary.